Okay, welcome to Caitlin, who's a Bupa physiotherapist. We're going to answer some of your quick fire questions on muscle and joint pain. So quick fire it is. Number one, is my footwear giving me back pain?
No, not necessarily. For most people, back pain is made up of an accumulation of lots of different factors, so your footwear might be one of them. Wearing flat shoes for a run might give you a bad back, but wearing the same pair of shoes to the gym would be perfectly fine. So it's just about picking the right footwear for the task.
Should people go to these sort of running shops where they, if you're getting problems, go to these running shops where they put you on a treadmill and assess you and guide you?
Yeah, gait analysis is great because you can understand if you need a more supportive footwear or less supportive. It's really individual. So yeah, go get it checked out. It's usually free.
Can too much screen time damage my neck?
Too much of anything is usually not very good for us. So prolonged time at the desk and looking at tech is no different. Changing your position regularly is really the best way to overcome any posture related injuries.
And that tech neck, it's from this, isn't it?
Yeah.
Doing too much of this. Is it getting common?
It is, but I think it's more about how enticing the activity on the tech is rather than the position itself.
Is running going to damage my knees?
The short answer is no, which is
Okay,
great.
good.
There are lots of injuries that can occur with running, but they're usually because people have progressed their speed or their distance a bit quicker than their muscles, bones, joints have been able to adapt to the activity. So follow a graded plan and do some strength training on the side to avoid any injuries.
Do you have to see a physio face to face for it to work?
No, this is a common misconception. A lot of what physio is listening to what the problem is, doing some screening over a virtual platform to then help determine, do you need that in-person assessment and treatment, or are you okay to continue virtually? A lot of our assessment is based on what you tell us, and then we'll do some movement screens and tests to confirm or deny what we've been thinking, and then get you set up on a treatment plan. But there are definitely some scenarios where an in-person assessment and in-person treatment is needed, but your physio should be able to guide you on that.
So, but I guess the initial assessment then can actually be done.
Yeah, telephone
over
screen,
the phone.
definitely.
Yeah. If I have muscle and joint pain, rest is best or not really?
Not necessarily. It's more about dialing things back, make it relative to the injury, and then gradually build up as you recover from a sprain or a strain. For more chronic conditions like arthritis and low back pain, movement is key because our muscles and joints lubricate themselves as they move. So it's all about working maybe with a physio or a coach to try and break the movement down into more manageable chunks to eventually progress into the full normal, whatever that means for you.
Okay, brilliant. Well, Caitlin, thank you so much. 5 quick questions and quick answers that hopefully you took something away from.